eventually have a level of palpation skills where you can literally affect the attachments off of the bone, skin on skin is very, very intense. Not only that, if you manage to perform effective treatment through multiple layers of clothing, can you imagine how effective they'll be when you have no layers between your contact and them? All right, Byron, thank you for joining us. So we're just going to be doing a little bit of a quick demo with the students. You do not need to get undressed for this demo. For this demo, I will be placing my hands probably around your back area, around your hip, and around the back of your leg, as well as when we have you turned over, we're just going to work primarily across the upper chest and into the arm and shoulder area, possibly down into the lats. Purpose of this is to demonstrate some really interesting techniques to students. We might possibly elicit some discomfort. If we do, please let me know and I'll modify accordingly. But hopefully we'll be able to help you balance out your fascia chains. Yay. Do you have any questions about what we're going to do? Do I have permission to continue? Awesome. Can I start with you face down on the table, please? So the reason why I'm bringing up the work of fascial chains is because you know that the majority of my classes has been about, you know, finding imbalances, correcting rotations, dealing with asymmetries. Well, eventually, when we get towards the middle of term 6, we are going to be talking about doing multiple corrections in a single treatment. Now, the thing is, though, corrections, they really don't take a whole lot of time. But yet, you are going to be with your patient for up to like 50 minutes of hands-on time, 45 to 50 minutes of direct hands-on time. Now, the thing is we have a benefit that no other modality of manual healthcare does, except for maybe osteopaths. Chiros, average appointment, half hour for an initial, 15 minutes for a follow-up, right? Physios, half-hour appointments. How much of that time do they spend with direct contact with your patient's tissues? In a 15-minute treatment, do they spend that whole 15 minutes hands-on? What about physios? No. We get to spend upwards of almost 45 to 50 minutes of direct contact with our patient's tissues, right? If we don't utilize that time to be able to actually communicate with the tissues and understand a real-time conversation with the tissues, then we are not only not giving our patient the best care that we could possibly give them just by doing passive massage, but we aren't necessarily working on our palpation skills. The reason why I bring that up is because a lot of the times there are discussions that come up regarding there being multiple designations in the RMT profession. There are your massage providers, and then there are your remedial practitioners. Right? There's a reason why a lot of individuals who come and see me for the first time are really blown away. And they sometimes double check, they're like, this is a massage appointment, right? This is a massage therapy appointment. A lot of the times, too many people are focused on the M aspect of our RMT title, registered massage therapist. Hopefully, by exposing you to the idea of different avenues of treatment, you'll be able to shift your focus a bit more on the T aspect of that title, registered massage therapist, right? If you just want to give passive massage, you're getting a ton of additional education that is not necessarily beneficial to your massage practice, but to your therapeutic practice. That's where this is going to come into play. All right, when it comes to fascial chains, Byron, are you centered on the table? Don't look.
Guess not.
Do you feel like you're centered on the
I
table?
am.
Okay, what do we see?
He's not centered, he's off to left side.
So what does that tell us about this chain versus this chain? One side is tighter, one side is overstretched. So are we going to treat both sides the same?
No.
No. Do we know, just by looking at this individual, which side is their problematic side or which side gives them grief? We can't tell. Because for some people, it's the approximated side that gives them grief. Some people, it's the overstretched side. Either way, there is imbalance and dysfunction. So the easiest way is to not think, oh, his QL is having issues here, it's hypertoned over here. Are you sure it's just the QL? Because it looks like it's the entire chain that's affected to me, right? So when it comes to that, if you were to assess him in this position, it actually feels like he is approximated on one side and elongated on one side. All right, so I want to get you guys to do a palpation train to feel this on your own, but I know that after we get like 10 students in, it will balance out as you guys are palpating because it's like semi-massage. So we'll give it a try. Yeah, we'll give it a try. All right, so very briefly, Byron, is it okay if we do a little palpation train for everybody to feel your low back? Okay, cool. I will get you to come up. Yeah.
So when in previous term when they said also treat on the unaffected side, it not necessarily means same amount of time too, right?
Correct, that is correct. When we say treat the unaffected side first, it does not mean to completion. You are correct. Now that is where there's a little bit of a hindrance here, and this is why I call this a bonus lecture, because this is outside of the curriculum. Okay? Now keep in mind, Principles of Massage tells you treat the unaffected side first, right? But the thing is though, if he is elongated and his issue is on the approximated side, he's complaining about dysfunction in the approximated side, it's telling us that then we need to work on the unaffected side first. But the thing is, in order to give slack to this side here, what's something that we can do to give slack, or to give slack to the overstretched side? What's something that we can do to immediately balance this out? Approximate. Yeah, I can approximate him. But the thing is though, if we try and approximate this elongated side without getting this approximated side to let go, how tight do you think this side is going to be once we bring him over? Very, right? So Principles of Massage says treats the unaffected side first for a variety of reasons. Introduction of touch also establishes a baseline of how their tissue should be feeling. But in the context of tightness in the chains, you want to try and keep it as balanced as possible. So if one side is super, super overstretched and one side is super, super approximated, based off of trying to maintain balance, I should actually try to elongate the approximated side first, because that will allow me to give slack into the elongated side. Because remember, we're not going to just make softness in the tissue out of nowhere. That has to come from somewhere. All right, hence why I also put the shoulder pillows under his shoulders. Now the reason why I'm bringing this up is because we've mentioned column rotations in the spine. We've mentioned rotated vertebrae. We've talked about an over-exaggeration of curvature. And in lower spinal, we're going to talk about an increase and a decrease in lordotic curve, but as well as a displaced sacrum. Now, if you can imagine rotated here, column rotation here, single rotated segment here, a hypo or lack of curve in his spine here with a counter nutated sacrum. How much additional tension do you think is applied to that central chain by having all of those slight deviations? A lot, right? The most aggressive one to try and address is going to be that one rotated segment, because it's sandwiched in amongst all of the vertebrae. So if that one segment is sandwiched amongst all of the vertebrae and there's additional tightness elsewhere, that segment is going to be super difficult to try and correct. Right? So we're not going to go in and try and correct that segment right away. That's actually going to be the very last thing I do. What I'm going to do is going to try and balance everywhere else along the spine and in the fascial chains, and that will give slack to this area to make that segment easy to address. Does that make sense? Okay. So now we're going to go ahead and do that little bit of a palpation train so you guys can feel how his one side feels like it's actually stretched and the other side actually feels like it's approximated. Okay, try not to spend too long because we do have a few people to get through. So Byron has already given his consent. I would like you guys to come up to the top of the table and just compare to see if you can feel the difference in the tissues of his low back on one side to the other. If you can't, that's okay. We're going to do another one and we're going to make it more obvious. So come along and palpate, see if you can feel the difference in his back. That means now, y'all, come on.